Do your legs feel tired, numb, or even cold for no apparent reason? It might be more than just fatigue. These could be warning signs that your arteries are blocked and your heart is at risk. Blocked arteries aren't just something that happens in your heart, they can affect your legs and feet too, leading to a condition known as peripheral artery disease, or PAD. When the arteries in your legs are blocked, your blood flow is restricted, which can cause a range of serious symptoms that are often overlooked. Recognizing these signs early is crucial because ignoring them can lead to dangerous complications, including heart attacks, strokes, and even limb loss. In this video, we'll be going over 6 warning signs that could indicate blocked arteries in your legs and feet. Understanding these symptoms early on can make a massive difference in preventing serious health issues down the road, so stay tuned as we break it all down for you. Blocked arteries occur when fatty deposits, known as plaque, build up in the walls of the arteries, restricting blood flow. When this happens in the arteries that supply your legs and feet, it leads to a condition called peripheral artery disease, or PAD. PAD is essentially a form of atherosclerosis, where plaque accumulates in the peripheral arteries, reducing blood flow to your extremities. PAD isn't just a problem for your legs, it's a major warning sign for heart health. The plaque buildup that blocks arteries in the legs can also occur in the arteries that supply blood to your heart and brain, increasing your risk for heart attacks and strokes. In fact, people with PAD are significantly more likely to have coronary artery disease or cerebrovascular disease, making it even more important to recognize and treat the signs of blocked arteries early. But how can you tell if you're experiencing these warning signs? Stay tuned, because up next, we'll dive into the 6 key symptoms you need to watch out for, and some of them may surprise you. Number 1. Leg pain and cramping. One of the most common warning signs of blocked arteries in the legs is pain or cramping, especially during physical activities like walking, climbing stairs, or even standing for long periods. This pain typically feels like an aching or cramping sensation and is often described as a heaviness or tightness in the muscles, particularly in the calves, thighs, or hips. The pain occurs because your muscles aren't getting enough blood flow and oxygen to meet the demands of the activity, causing them to fatigue much faster than usual. You might notice that the pain starts after walking a short distance but goes away once you stop and rest. This is a classic hallmark of intermittent claudication, a key symptom of peripheral artery disease, PAD. What makes this pain different from regular muscle soreness is that it doesn't occur because of overuse or physical strain. Normal soreness happens after intense activity, like a tough workout, and typically involves a gradual buildup of discomfort as your muscles recover. With PAD, the pain can strike even with light activity and tends to disappear quickly when you stop moving. It's not the kind of soreness that improves with stretching or resting for a while, it comes back every time your muscles demand more blood than your arteries can deliver. If you find yourself avoiding certain activities because of pain or cramping in your legs, it's important to take note. This isn't just fatigue, it's your body signaling that something may be wrong with your circulation. In the early stages, this discomfort may be easy to ignore or dismiss as part of getting older, but it's crucial to recognize that recurring leg pain during movement can be a significant red flag for blocked arteries. And if left untreated, the condition can progress, leading to more severe complications down the road. Number 2. Numbness or weakness. Another critical sign of blocked arteries in your legs is numbness or weakness. When your arteries are narrowed due to plaque buildup, it reduces blood flow to your legs and feet, depriving your muscles and nerves of the oxygen they need to function properly. As a result, you might experience a sensation of numbness, tingling, or even a feeling of weakness in your legs. This can happen suddenly or gradually, but it's a strong indication that your circulation is compromised. You may notice this numbness or weakness in situations where blood flow is already restricted, such as when you're sitting for long periods or keeping your legs in one position for an extended time. Your legs might feel like they've fallen asleep or become weak, making it difficult to stand up or walk normally after sitting down. Some people also experience this sensation after climbing stairs or walking short distances. While numbness might temporarily subside after moving around or changing positions, it's not something to ignore, especially if it keeps recurring. Unlike regular fatigue, which improves with rest and movement, numbness and weakness caused by poor circulation won't go away easily without addressing the underlying issue. It's your body's way of telling you that your muscles and nerves aren't getting the blood flow they need. Ignoring this symptom can lead to further complications, such as increasing weakness and even the loss of muscle function over time, so it's vital to take action if you notice these warning signs. Number 3. Coldness in the lower leg or foot. One lesser-known yet significant warning sign of blocked arteries is coldness in the lower leg or foot, particularly when you notice that one leg or foot feels colder than the other. This temperature difference happens because poor circulation prevents enough warm, oxygenated blood from reaching the affected limb. Your body relies on proper blood flow to regulate temperature and keep your tissues healthy, so when blood flow is restricted due to blocked arteries, it can cause certain areas, especially your extremities, to feel noticeably cooler. This coldness is often most noticeable when you're resting, such as sitting or lying down, since your body isn't actively pumping as much blood to the muscles as it would during movement. If one foot or lower leg consistently feels colder than the other, it's a sign that blood isn't circulating evenly to that area. Unlike a temporary chill from being in a cold environment, the sensation doesn't go away easily with warmth or movement and might persist, even when the rest of your body feels warm. Reduced blood flow in the leg or foot not only affects temperature but also signals that the muscles and tissues are being deprived of oxygen, which can lead to more serious problems if left untreated. If you're experiencing this symptom, it's important to pay attention, as it could be an early indication of peripheral artery disease. Over time, this can lead to more severe complications, like tissue damage or even ulcers, if circulation doesn't improve. So, if you find yourself frequently dealing with one cold leg or foot, it's worth getting checked out by a healthcare professional. Number 4. Sores or wounds that won't heal. Another alarming sign of blocked arteries in your legs or feet is the presence of sores or wounds that won't heal. When your arteries are narrowed due to plaque buildup, the blood flow to your legs and feet becomes severely reduced. Since your body relies on oxygen-rich blood to repair damaged tissues and heal wounds, insufficient circulation means your body struggles to heal even minor injuries. Cuts, scrapes, or blisters that would normally heal within a few days might linger for weeks or even months without showing signs of improvement. Number 5. Changes in skin color or texture. Blocked arteries in the legs and feet can also cause noticeable changes in skin color or texture, which are key warning signs of reduced blood flow. When the arteries are blocked, the skin in the affected area isn't getting enough oxygen-rich blood, leading to visible changes. The skin may appear pale or even take on a bluish tint, especially in the toes or lower legs, because the blood isn't circulating properly. In some cases, you might also notice that the skin becomes shiny or takes on a thin, fragile appearance, which is a sign that the tissues underneath aren't receiving enough nutrients to stay healthy. Number 6. Weak pulse in the legs or feet. A weak pulse in the legs or feet is another serious warning sign of blocked arteries. Your pulse is the rhythmic beating caused by blood moving through your arteries, and it can be felt in several areas of the body, including the feet and ankles. A weak or absent pulse in the legs or feet is often a sign that the arteries are narrowed or blocked, preventing blood from circulating properly to your lower extremities. This reduced circulation is a hallmark of peripheral artery disease, PAD, and suggests that your body is struggling to deliver enough oxygen-rich blood to the muscles and tissues in your legs and feet. If you found this video informative and inspiring, please give us a thumbs up, subscribe to our channel for more health and wellness content, and don't forget to hit that notification bell so you never miss an update. And of course, we'd love to hear from you. Share your thoughts or any questions you might have in the comments below.